Well, if you put it in as one glob, it shrinks. They all shrink anywhere from maybe 1.25% to as much as 5 or 6%. As they shrink, they pull on the tooth, which can stress the tooth internally, or they can debond over time. So we don't want either of those to happen. So by doing small layers, curing it, another small layer, curing it, we decrease the amount of stress that's placed on a person's tooth, because ultimately we want the tooth to mimic as close as we can to Mother Nature.
Great, thank you.
I hope that explains I hope that answers your question.
Yeah, it absolutely does. It absolutely does. So, we had a speaker on yesterday, or a couple of days ago, Dr. Michelle Jorgensen, and she was talking about infections in the mouth. Like if you had a root canal, you most likely have an infection still in your mouth. There's gaps in there, as well as wisdom teeth. A lot of times it's not done right, and there's these these infections that can cause havoc throughout the body. What are your thoughts on that? Is that part of stuff that you do? Do you see that people have these underlying infections with some of these I guess procedures that you're trying to avoid with
right.
Biomedic? That's how you say it, Biomedic? Dentistry?
Yeah, Biomedic.
Biomedic.
Yeah. Well, biomedic dentistry is more the dental engineering aspect of rebuilding teeth. It's not the same as biologic dentistry or holistic dentistry. So they're separated out. However, they should almost be merged, because as a holistic dentist, you want to prevent root canals. Because root canals, as I mentioned earlier, and I said I'll talk about it some more, is a gray area. And I did mention also, I'll talk a little bit more about, we can go in where there's deep decay. If the tooth is still alive, we can leave decay now, and the body will heal itself. But we have to remove decay in a certain area, a certain specific way. And if we do that and leave a little bit of the decay behind without going into the nerve, we prevent root canals. It's a big paradigm shift. Most dentists were taught, oh, well, that cavity's deep. You might as well get a root canal now because you'll probably need one later. Like no connection between a root canal and overall body symptomology down the line, or weird systemic effects. But going back to your question, when a person receives a root canal, it's very technique sensitive. So it depends who's doing the root canal and what kind of procedure they're using. Without an illustration here, it's sometimes a little bit hard to explain, but I do go over that a little bit on the freeholisticdentalcourse.com. I lightly touch upon it, but you can imagine a root canal itself. Down inside the root of the tooth is a nerve. There's a vein, and there's a red blood vessel, right? There's a small little capillary. So they're in a triplet. That's how things kind of usually move throughout the body. You usually have a vein, an artery, and a nerve following the same pathway. So as a tooth is developing as a little bud, it needs a blood supply to keep the nourishments coming in. And then once it fully erupts and comes in, the blood supply remains intact, and that's the nerve inside the tooth and the pulp, and it keeps the tooth hydrated, which is nice. Every pumping of the heart, it floods up through there. And what people don't know is that there's little tiny tubules going from the nerve outward all the way to the root system and all the way up near the enamel of the tooth. They're called tubules. And they're filled with some of this solution, inorganic and organic type, mostly organic type solution in there. And what happens is that by this nice hydration, there's a pulsation. When a tooth gets severe tooth decay, if the bacteria can invade far enough and contaminate and inflame the nerve gets inflamed. Well, it's the same way if the brain gets inflamed, the doctors have to go in and they have to open part of the skull and get it to drain out so it doesn't choke itself off. So what happens inside a tooth? It strangles itself by the inflammation. And then all of a sudden, a person says, oh, I have a toothache because there's such pressure there. And it can be excruciating to minor dull ache. Everybody's different how they respond. So the treatment of choice has been around for about 100 years or so, to go in open the tooth a little bit and take that little spaghetti string of material out of there, which is the nerve and the little artery and the little vein. It's all one piece, and they scoop it out. And the way that they scoop it out is with little files. And now we use an X-ray to measure it. And by measuring it, then we know where the length of it is down near the root. We want to seal it as close to the end as we can. But that was looking at it strictly from a larger viewpoint with an X-ray, and not realizing the anatomy of the tooth has all these tubules. So we could clean the big canal out, put some sterilizing materials down in there. But then after we did that, what would happen? Well, it appeared that some of the bacteria still migrated and hid in those little dental tubules. And they would then mutate into a more harmful type of anaerobic, which would be non-oxygen breathing bacteria, and it mutates and it becomes a problem. What's the problem? Well, it can create latent infection, it can create hidden infection, or there can be toxins that you can measure under there. Where do those toxins go? Well, they go into the bloodstream. Does it affect a person? It might. And the truth is, some say, yes, it does 100%. Others say, no, it doesn't. The science is still a little bit in the middle on it. We can show blood tests and show that there's range differences in people that have had the root canals, especially if there might be some infection there. And there used to be a test where we could take a sample down along the side of the tooth and have it cultured to see what possibly could be brewing around that tooth. Well, what was discovered by a chemist, Dr. Boyd Haley, out of University of, I think he's up in Kentucky. He's a professor emeritus, and he had this company where you could sample what kind of toxins were coming out of there. He sold the company, and sadly, they went out of business. So it's not available at the moment. But he represented a lot of dentists that pulled people's root canal teeth, and he said every single one had toxic sludge and bacteria around them. So I asked him, I said, well, Boyd, what should we do? Does that mean we should pull every single root canal out there? I mean, he said, no, I don't think that's the answer either. And we both kind of came up with the same thought that it's somewhere, it would be nice if we had a systemic test to see if someone's being negatively affected by that, or someone could be negatively affected by that. And some people could, like if their immune system's crashed or things like that. As a holistic dentist, we have to look at them and go, okay, is this going to be a viable treatment for them, or could it crash their immune system more? So we just don't have a perfect way of going, okay, this one's infected and your body can't handle that load. Because some people, they can have infection, they can have stuff going on, and they're living pretty happy into their 80s and early 90s. And then there's other people, like I had a 18-year-old patient. She had chronic fatigue. She got sick, couldn't get out of bed for 3 or 4 months. When she finally did get the energy to come in, she had some infected molars and a couple of wisdom teeth as well. Now, normally I'd say take the wisdom teeth out, and maybe the others we could rebuild, and maybe she could get a more holistic type of root canal. In her case, I said, nope, let's get them all out because they're just so badly infected, and let's see. So we did, and within 2 or 3 months, she had a full recovery. Well, that's miraculous, and we love it. It's not always the case. And so the big message I would have for people watching the show is that, many of the symptoms that go on with our bodies, many of the things that go on, it's not just from one thing. It's generally multifaceted. This may be a contributing factor. So you have to go through your list like, okay, is there infection? Should have that evaluated. You can have a CT scan done. We can see if there's infection around old root canal teeth, old extractions. Are there little areas where the bone didn't heal in fully? We call them cavitations, where they have to be opened up and cleaned out. But is that the thing that's causing some maybe mysterious illness? We don't know. So the person has to go, okay, it's part of their journey. They go in, they get things done. I don't even know if it's above the placebo effect, 22% or 18%, that actually feel better. But most have done the research and they go, you know what? I got that toxic sludge in there. I got something showing up. I'm just going to get it cleaned out as a preventative thing. I think that's really wise. I would always advise that if it's not harmful, if the little cavitation is not near a major nerve or anything like that, it seems to make sense. So there's a lot of things for people to sort of weigh and look at. Now, if a person does decide they're going to have a root canal, there's a couple of procedures they can look at. One is called the gentle wave root canal procedure. And that's just a machine that, rather than packing a file down on that in that nerve and maybe pushing debris laterally, which blocks the dental tubules and blocks bacteria in there, this is more like a vacuum, and it suctions it out, cleans it out so that the dental tubules are completely open. Then they can use their sterilization agents to kill any bacteria living in the surrounding area from the main canals outward. The question still remains, I don't know if on the outside of the tooth, if the bacteria can get in from the outside through those dental tubules, because there's no way to fully seal all those little hundreds of thousands of dental tubules in there. They're so minute and they're so tiny. You would have to, anything pushing through there would crack the tooth. It's too much force.